And we are live. Okay. Hello, everybody. It's Dr. Alex Earle here, and it's Hump Day with Dr. Alex Earle. This is the time I get to spend with you guys and go over plastic surgery topics and answer all of your plastic surgery questions. That's right. And you know that it's coming from a good and reliable source because I am a double board certified plastic surgeon, Ivy League educated, Duke trained, with over a decade of experience and thousands of procedures under my belt. And so I am happy to answer any question regarding plastic surgery from head to toe, from pre-op to post-op, okay? But today, before we answer some of those questions, today I want to introduce our newest kind of procedure here at Pure, which we are calling the Mami Makeover. That's right. So the Mami Makeover, it is basically your Mommy Makeover, but with a little Miami flair, a little twist, right? And so that's what we're bringing here to you. So we're talking about the Mommy Makeover, and what are we talking about when we refer to that? Well, we're referring to a breast surgery, which we'll talk here in a bit, but that's going to be combined with your tummy tuck, and of course with the lipo. And one of the key things of the Mommy Makeover is one of the big differentiators there is the fat transfer to the hips. All right. So what is it? Yeah, your MMO Miami style, and more specifically Pure and Dr. Earle style. So the breasts. All right. So the breast can be any breast surgery, and so that ranges anywhere from your simple kind of straight up breast augmentation all the way through your breast reduction or breast lift with or without implants. Okay, so certainly any breast surgery that you're looking for, breast lift, breast reduction, and this can be with or without implants. And let me talk about that a little bit. So in terms of breast augmentation, because people ask me this all the time, what is my preferred approach for the implant? So for breast augmentation, I like to put the implant in a pocket that you may not have heard about before because it is a relatively new technique, and it's called the subfascial approach, which is above the muscle but not the same as what you thought about before where you're just simply putting the implant above the muscle in that subglandular approach. Okay, so it is above the muscle, but it's in a special plane. It's in an area between the fascia, which is this thick layer that is over the muscle. Now with newer techniques, you can actually create a pocket that is between that fascia and the muscle, so the muscle stays down, the fascia comes up, which is why it's called the subfascial plane, and it gives you the best of all worlds because you have extremely low capsular contraction rates. I'm talking about 1%, okay? And at the same time, you don't have an animation deformity. So when the patient is exercising or being active, the implants are not jumping and moving around. So it is the best of both worlds. Not everyone knows how to do this technique, and some people get confused with it, thinking that it's just simply above the muscle, and it's not. Like I said, it's called the subfascial approach, and I would ask this to any plastic surgeon that you're planning on going to for your breast augmentation. Okay. Now, when I'm doing an implant and combining that with either a breast lift or a breast reduction, well, in that particular case, now I do want a little bit more coverage for the implant. I want to make sure that that implant is not going to, become exposed. And because with these surgeries, we have a lot more incisions, I protect it a little bit more. So with the breast lift or the breast reduction, I do put the implant in below the muscle in that submuscular plane. Okay, and what type of a lift can you do? It can be any type of lift. It can be your donut lift, your vertical or lollipop lift, or it can be your anchor type lift as well. Okay, but what have we been seeing more lately? What we've been seeing a lot lately is actually women who want a breast lift with and no implant, just a breast lift, or we've also seen a lot of patients that want a basically what we call an explant. They want to remove their implants and then do a breast lift. And so that's been trending lately as well. Okay. All right, so next really comes your tummy tuck, all right? So, but we're not talking about here your tummy tuck you may have seen elsewhere, certainly outside of Miami, where you just end up looking like very squarish, right? So simply they just remove some excess skin, but the patient looks very scared, very much like a square. That is not what we're talking about. That's what makes the difference here. That's why it's called the Mami Makeover, because we're doing an hourglass tummy tuck, okay? So you have your hourglass tummy tuck. So on the inside, we're going to be doing that muscle repair. Okay, and we do it in a way that we call it basically an internal corset, where we're really cinching in that waist from the inside, so you get your muscle repair with internal corset. Of course, we're going to be removing all the excess skin, and the key is also the belly button. So I create the belly button in a way where I try to tuck in the incision as much as I can, so that it's not so visible from the outside. Beautiful belly buttons, and you know how you make great belly buttons? When your Mami Makeover patients or tummy tuck patients are walking around with midriffs, right? Where they're like proudly showing their belly button because of how great and how natural it looks. And so that's how you know you have a great belly button. So that is a key thing here, is making that beautiful, natural looking belly button, okay? So that's part of the Mami Makeover there. And then, of course, we have to contour the body. So we're doing the liposuction to the flanks and the waist, but not only that, we do a little bit along the belly as well. We can create some of the lines there if you want to have kind of that enhanced, natural, but very feminine looking athletic look. It could be done at that time as well for the right patients, right? Those that are a little bit on the lower BMI scale, perhaps not for the higher BMI patients, okay? But we can create that beautiful look. And then here is like the center, the one to like really bring out those curves, is to accentuate the hips. And we can do that with a fat transfer to the hips, okay? And so the fact that you're cinching in the waist in a few ways, right? You're cinching in the waist because you're doing that internal corset muscle repair, but then you're also doing the lipo to the flanks and the waist. Those two things will allow you to bring the waist in, and then on top of that, you're rounding out the hips. That's going to be a key way to then really bring out those curves and bring out that hourglass tummy tuck that we're going to be combining them with the breast for your full-on Mami Makeover. And what's going to be the final result? Well, the final result is confidence through the roof. That's right. So improving self-esteem, improving self-confidence, to the point that you're feeling extremely good about yourself and you're happy to show your body, even the small bikini out on the beach, because your belly button looks great, it looks extremely natural, that incision's tucked in. All the other incisions are placed in a way that are very easy to hide in that swimsuit. For example, the lower tummy tuck incisions placed in a nice gentle curve, being very cognizant of where the swimsuit would go, so that you have extreme self-confidence as you go out to the pool or the beach for the summer, which is coming up very, very soon. All right? And Willie, when are summer bodies made?
Well, winter.
Ideally in the winter. Maybe, if you can get it in the spring.
Next week, maybe next week.
You have to do that now, because you're going to be ready for the beach at approximately 6 weeks after surgery, right? And so we're already starting in May. So the kids maybe have about another month left in school or so. Okay, so if you want that summer body, you got to call us like right now. Right now. Okay. All right. Well, I am happy to go over any questions.
Doc, we have a lot.
Great. So
we have to go like boom, 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 boom.
And today I've left quite a bit of time for questions, because I know sometimes I talk a little bit too long. But yes, today we got time for questions, so let's do it.
Okay, let's start here. Dr. Earle, on
Yes.
TikTok, my BBL was 3 years ago. I literally came off the table looking the same.
Ooh, okay.
It's not your patient.
All right.
So, after my second with you, I want to show how I'm looking because of Dr. Earle.
Oh,
So she gets a
okay.
second round with you.
Yes. Excellent. All right, so let's talk about that a little bit. Yeah, sometimes you can have, say, for example, your first liposuction or BBL, and maybe you're not happy with the results. Maybe the surgeon wasn't aggressive enough, or it can be several factors. So maybe you're too thin at that time, things of that nature. But it is certainly possible to do a round two. And so when you do a round two, of course, you want to make sure that you're optimally prepared for that surgery. So say, for example, if you started with a maybe too low a BMI, maybe you gain a little weight for the next surgery, and then that will make sure that you end up being more curvy after all. So these are things that can be done. My recommendation is always to send in your information for an evaluation, and you can do that very easily online. So you go to our website, www.pureplasticsurgery.com. You can click a button that says start your journey or virtual consultation. Send us your info, send us your photo. I'll be able to do an evaluation, and then I can make some recommendations from there.
Doc, what if you encounter a hernia during a tummy tuck? Do you fix it?
Yeah, so that's one of the great things that you can do during a tummy tuck is you can fix certainly most belly button or umbilical hernias. And you can also fix some smaller ventral hernias, or hernias that are not just around the belly button, but anywhere kind of in that front belly area. Okay? So yes, if I encounter a hernia at the time of the tummy tuck, I will definitely fix it.
I love to have a mommy makeover and also a BBL. So, could
Yes.
be a tummy tuck with a BBL is the question?
No, so those are the types of surgeries that I would not combine. Okay, I don't recommend that for multiple reasons. I think the complication rates go way up, and so the rates of bleeding, needing blood transfusions, infections, or the rates of a blood clot, such as what's called a deep vein thrombosis in the legs or a pulmonary embolus, go way high, and those can be very, very dangerous potentially. Right? So I don't recommend combining the Mami Makeover or the Mami Makeover and the BBL. It's best to separate these surgeries, and when you're going to do that, I always recommend the surgery that's going to involve the tummy tuck first. All right, so if you're doing the Mami Makeover, do that first. If you're doing just a straight up tummy tuck, again, do that first, okay, and then come back 3 or 4 months later to do your liposculpture and BBL.
What should I look for or ask a surgeon before having an upper left?
Oh, great. Okay, so first of all, for those who may not know what that means, an upper bleft means that we're dealing with the upper eyelid. So it's upper eyelid surgery, and typically what it involves is removing excess skin to the upper eyelid. So what do you look for in a surgeon? So first of all, you want to make sure that you're looking at a board certified plastic surgeon, okay? Or sometimes they can be someone who specializes specifically in what's called oculoplastics, okay? And so they've had an additional training or fellowship in something called oculoplastics, all right? Of course, you want to go with someone who has quite a bit of experience with that procedure, and who you're able to see the reviews and also their before and afters. And so if you're able to compile all that information together and everything looks good, then you can reach out to that surgeon, do a consultation, which can be even virtual or in person, and then take it from there.
Dr. Earle, why do you not perform a body lift?
So I personally don't perform what's called a total body lift. So total body lift is essentially when you're combining the tummy tuck with like the lower back lift, or some people call it a buttock lift, the surgical buttock lift. I'm not talking about fat transfer here, okay? And so that is a big surgery. I think you have to have a fair amount of experience, especially with the posterior part of it, to really make sure that that looks good. And so it's just something that I love doing the tummy tucks, and I'll do that all day. Here at Pure Plastic Surgery, Dr. Vidal, who is truly excellent, she has the most experience with doing the posterior portion of it, so the total body lift or the buttock, the surgical buttock lift. And so for those patients that have had massive weight loss, I highly, highly recommend going to Dr. Vidal for that portion of the procedure.
Do you do thigh lift?
Again, so thigh lift is not one of my favorite procedures. Honestly, So I also believe Dr. Vidal has a great experience and expertise with that procedure, as she does with most of the procedures that are involved with massive weight loss. And so again, I would recommend Dr. Vidal for your thigh lifts as well.
Um, I'm 10 weeks post-op from a tummy tuck. How long
Okay.
do you recommend staying in a faja?
All right, great question. So at 10 weeks, I would say you're almost there. So I recommend that my patients be in a faja for a total of at least 12 weeks. Okay, that's the minimum though. The first 6 weeks, typically you're going to be in the faja night and day, and then the second 6 weeks, so between week 6 and week 12, you're going to be in the faja 12 hours a day. Okay, and then after that, a lot of patients can stop with the compression, but let me say this though, there are some patients where they still have quite a bit of swelling at 12 weeks, and so they opt to continue wearing the faja for, say a few more months, okay? And with a tummy tuck, it varies a lot between patients, but it's not unusual, so don't worry. If you're 6 months or even 8 months after your tummy tuck, and you still have quite a bit of swelling, especially in that lower belly or that suprapubic area, don't worry about it too much. Eventually, it will get better. Just continue your compression until then.
I'm 3 months post-op and start working out again. My
Okay.
breast feels tight.
Tight?
Could
Yeah.
it be CC, capsular contraction?
It's a possibility, so that's something that really needs to be evaluated. Okay. So what you typically see with capsular contracture, you start to feel that it is tighter on the one side. Sometimes it starts to look a little bit different. Typically, when you have capsular contracture and things start to tighten up, it starts to push the implant up a little bit higher. So sometimes in the side that you have capsular contracture, the implant can look higher than the other side. So those are kind of signs that you may be having some degree of capsular contracture. If you're able to kind of detect it early and call your plastic surgeon quickly, then a lot of times he can suggest massage and also a medication called Singular, which can help. And if you're able, like I said, if you're able to do that quickly with the massage and the Singular, you can actually prevent that capsular contracture from getting any worse, or sometimes you can actually even soften up the breast one more time. So the key is to try to get on top of it as quickly as possible.
Where are we located?
So we are at Pure Plastic Surgery. So we are in Miami, Florida, and specifically 7265 Southwest 93rd Ave, Miami, Florida, 33173.
I'm from Europe. Can I get surgery there?
There meaning here?
Yes. Yeah, with you.
Yeah. Yes, so definitely we get a lot of patients from out of town. Actually, I would say most of our patients are not from Miami, so most of our patients are from out of town, different states within the US, but certainly we get patients, international patients from Canada, and we've had a lot of international patients in Europe, a lot of people coming from England. But yes, we can definitely do that for you. So how do we get started? We get started with a virtual consultation. Again, very easy to do. Just go to our website, www.pureplasticsurgery.com, and we can get started that way.
Okay, another patient here on TikTok says, I came from New York.
Okay.
So
That's
she
right.
travels.
Yes.
What's the duration of the surgery for Lipo 360 and for Mami Makeover?
For the Mami Makeover.
Mami Makeover,
Yes.
yeah.
So Lipo 360 with Vaser, and I use Vaser for all of my Lipo 360 cases, typically takes about 2 hours. What is the Vaser? The Vaser is an additional step, a device that we use that uses ultrasound energy to basically knock off the fat cells from the surrounding tissue so I can remove more fat with less bleeding, less inflammation, and better skin retraction. It works really, really great. I highly recommend it, and I use it for all my liposculpture and BBL cases, okay? So that's gonna take about 2 hours. The Mami Makeover, it really depends on the breast portion of it. So if you're doing just a straight up breast aug and then everything else, that's also about 2 hours. If you're doing a breast lift or reduction with or without implant, that's gonna add another anywhere between 30 to 45 minutes to that case.
Okay, sorry. I had chin lipo 10 weeks ago, but I don't
Oh.
see the results. How long should I wait before redoing it?
Yeah, so it's honestly, what I would say, first of all, I would say, don't panic, right? It's not unusual to not really see the full results at 10 weeks out from the chin lipo. Things can still be, fairly swollen. You are still in the healing phase, and so I would recommend, waiting probably at least another, you know, 2 months, I would say at least. So, or maybe a little bit longer, like closer to your 6 months from the procedure before making any decisions in terms of, doing it over again or touch-ups or things like that.
Okay, how's a BBL reduction defined? Does it necessarily mean fat removal or are there other factors involved?
Right, so that's a great question. So this is a procedure that's growing lately, and we've seen it more and more here at Plastic Surgery, and we do that here. First of all, so everyone knows, we do BBL reductions and BBL reshapings here. It's not a procedure that any surgeon will take on because it can be potentially very challenging procedures, okay? But I do, and so I'm one of the few surgeons that will take on these cases. And so what does it entail? So it's, yes, it may require reducing volume, okay, or removing fat, but it's not as simple or as straightforward as that because it's really more typically of a reshaping procedure. I think that's like the number one thing is to reshape the BBL, and then yes, you can or you may or may not reduce the overall volume depending on what the patient wants or the patient needs, and also depending on the patient's unique underlying foundation, right? So in some patients we just may be only reshaping, but that does involve removing fat from certain areas and adding fat to other areas to say, for example, reduce a shelf and turn it more into a pokey slope, or reduce lats that are way too much, making the butt look squarish, reducing those lats, adding to the hips, and then making more of that kind of signature upside down heart shape. So those are all things that we can potentially do. But if you feel like, say, for example, your hips are just too wide, maybe they don't match your thighs, then yes, we can reduce the hip area, mostly via liposuction. Or if you feel like you just have too much projection, a little bit too much of an ant or diaper booty, then yes, we can reduce the volume there as well. But keep in mind that when we do that, we also have to treat the skin. We have to allow that skin to also retract back. So it's usually not only liposuction that we're doing, but we're also doing something that helps with the skin tightening, which can be Vaser plus or minus body tight, okay? And sometimes if you need further skin tightening after the procedure, you can also add some radiofrequency microneedling, such as Morpheus 8 treatments after the procedure as well.
When will Alloclay be available?
It's available now. That's right. So we are one of the very first in the nation to have the Alloclay available, and it's available right now. For those of who may not know what Alloclay is, so Alloclay is essentially off-the-shelf fat. It is truly revolutionary. You're getting fat off the shelf at room temperature, and you're using that fat to fill certain areas, which works extremely well, especially in the lower body. So you can use it to fill in hip dips, you can use it to fill in certain areas in the buttock that may need a little bit more volume, okay? It's not gonna replace a full BBL, but it can definitely, replace smaller areas that need a bit more volume, okay? And so it works really great because it can be done under local, in the clinic setting, super easy, you're in, you're out, you're on your way home, very little downtime, no general anesthesia required, okay? So regarding Alloclay, it is available here at Pure Plastic Surgery right now. So if you're interested in this procedure, again, give us a call or submit a form through the website.
Okay, Doc. How can you tell if a tummy tuck or lipo are needed?
Okay, so that's a great question, and we get this question a lot. A lot, and well, we get a lot of confusion here as well. We have a lot of patients that come in saying or thinking that they want liposuction or liposculpture, and we evaluate the patient and determine that they would be best or better off with a tummy tuck, okay? So how is that decision made? So a few factors. Number one, the skin, okay? So if you have, good quality skin, no stretch marks with bounce back or elasticity, then yeah, then liposuction is okay. But if you have poor quality skin, lots of stretch marks, very, very loose, kind of hanging over or crepey thin skin, then the tummy tuck is going to be the best option for you. That's the skin. Number two, the muscles. What's happening with the muscles underneath there? So if you had, say multiple pregnancies, for example, those muscles can become weak or separated. So if you have abdominal wall weakness or muscle weakness or separated muscles, then again, the best procedure is going to be the tummy tuck because we can address the muscles with the muscle repair that we talked about, okay? Remember, liposuction does not address the muscles in any way, shape, or form. So if you have separated muscles or weak muscles, liposuction is not going to do anything for you in that department, and therefore your belly won't be flat. You're still going to have that little pooch or bulge in the belly because the muscles are weak.
No question. Wishing you and the office a blessed day.
Oh, thank you, thank you, thank you. A blessed day for you as well.
This is about timing again. How long does the BBL surgery takes?
So with the BBL, someone had asked before how much is the liposuction or liposculpture or lipo 360 case. That's about 2 hours. So if you add the BBL portion to it, it's another 30 minutes. So about two and a half hours or so. Of course, this depends very, very much on the patient, right? If we have one of our smaller, lower BMI patients, it can be as quickly as an hour and a half. If you have a bigger patient with a lot of add-ons, say they're not just doing the 360, but they're also doing the arms and then adding body tight and then adding, chin, then maybe it's 3 hours. So it has a range there, but it can be anywhere as quickly as an hour and a half to up to 3 hours.
I just lost about 100 pounds.
Congratulations.
I have a couple of areas with extra skin.
Yes.
Can I still do a BBL or will I need to do the skin removal first in order for the BBL to look right?
Yes. So can you do a BBL? You can do a BBL, but that's not what I recommend doing first, right? So I do recommend doing the skin procedures first, especially the ones that involve the trunk. For example, if you have a lot of loose overhanging skin in the belly, I recommend doing your tummy tuck first. If you develop quite a significant amount of loose skin in the back, sometimes you may need that bra line back lift. Or if you have a lot of loose skin in the buttock area, then that surgical buttock lift, okay? Once everything has been tightened up, all the loose skin has been removed, any muscles that need to be repaired are repaired, then that's the best time to have your liposculpture and fat transfer procedure or BBL.
Oh. Recommendations for skin tightening prior to surgery.
Prior to surgery, okay. Again, so we're talking here about maybe some mild skin laxity, right? Because if you have moderate to severe loose skin, then you're going to need a procedure such as a tummy tuck, okay? If you have just some mild skin laxity, then you can try different things such as lasers or the Morpheus RF or radio frequency microneedling can help tighten up the skin a little bit before the surgery. But the other thing you can consider if you have kind of mild to low moderate skin laxity is to do something at the time of surgery, which is really what I recommend the most. So at the time of surgery, you can add a Vaser, and then you can add body tight, which uses RF energy as well to tighten the skin at that time.
Okay. For a consultation for a Mami Makeover, she's asking about price, but
All right. So for consultations with me, there's 3 tiers, okay, and therefore 3 levels of pricing, okay. You can do what we call a completely virtual consultation, which is online. I've mentioned it a few times, but you go to our website, www.pureplasticsurgery.com, and you click on the button that says virtual consultation or start your journey, and then we'll take it from there, okay? You're gonna fill out your questionnaire, you're gonna send your photos, I look over all that information and send you my recommendations, and so the cost of that virtual consultation is $0. Gratis, free, $0, okay? Now, if you want to have a video consultation with me, because you're either super busy or you're from out of town or international, then we can do that as well. It's not a problem, but that cost is going to be $250. Okay. Now, it's $250 for the consultation, but if you book your surgery, those $250 go towards your surgery. So you're not paying that like additional money. It goes towards the surgery, okay? And then last but not least, if you want to have an in-person consultation with me, that is also possible, but the cost for that consultation is going to be $500, okay? Once again, that goes towards your surgery, okay? So it's not additional money that you're paying. It goes towards your quote, towards your surgery. Okay? All right. Okay, everybody. Well, we got in some good questions this time. We kept the presentation a little short because I know every once in a while you just want me to like run through all these questions. If you have any particular topic you want me to talk about next week, please let us know. All right, shoot us a DM and we'll put that there on the list. And yeah, I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. I'll see you then. Take care, everybody. Ciao.
Okay.